I'm from La Trobe University in Bendigo, and I'm actually from around this region to begin with.
Excellent. And you conducted your student placements here at North East Health Wangaratta.
Yeah, so I came in at the end of last year to do my SHPA summer placement, and I had such a great time and really enjoyed it that I couldn't help but come back for internship this year.
So now that you're here, what's your current rotation and what's your experience of the program been like so far?
So my current rotation, I'm really lucky to be in CCU, our brand new ICU building, and that's really exciting, getting to take a deeper look at patients, and it's a really good learning opportunity.
Hi, my name is Patrick and I'm a pharmacy intern here at North East Health Wangaratta.
Where'd you first hear about North East Health Wangaratta?
So when I was a fourth year pharmacy student at the University of Canberra, Wangaratta came up as an option to do placement at, and I mainly chose it because I wanted to go somewhere different and outside of Canberra.
And had you ever been on a hospital pharmacy placement before that?
I'd been on a few short hospital pharmacy placements which really hadn't given me much experience, but my 2 weeks here at North East Health really opened my eyes to what hospital pharmacy is all about, and I really enjoyed it. And part of coming back here for my internship was around the support of staff and the help for the exams preparation for our internship.
So can you tell us a little bit about the program so far and what your current rotation is and what you're up to?
So far I'm working on the medical ward and I have my own rotation on the maternity ward, working as the intern pharmacist up there. And I've got to see a lot of different patients here as a regional hospital, which is really exciting, and just some broad general medications, which is really good.
And so what's it been like to take responsibility for delivering the pharmacy service to your own ward so early on in your internship?
Yeah, it's really huge. It's definitely scary at first, but I've found that it's really helped accelerate my knowledge because it's had to keep up, and that responsibility has allowed me to actually enjoy what I'm doing and feel like I'm in control and that I'm actually useful out on the ward rather than just following around and ghosting someone.
Hi everyone, so my name is Sean. I'm a pharmacy intern here at North East Health Wangaratta after graduating at the University of Canberra.
So what made you consider applying at North East Health Wangaratta for your internship?
So North East Health Wangaratta has really got a fantastic internship program. They really try to facilitate our learning as much as they can with internal tutorials, seminars and case studies, so it's been a really great opportunity to expand our learning. They also provide lots of opportunities outside of the main hospital to expand our knowledge of pharmacy, such as local community pharmacy rotations to smaller hospitals, that all really provide a different point of view of pharmacy as a whole.
So you've recently had a rotation to Benalla Health, where we also have an intern who shares her time between Benalla and North East Health. What was your week at Benalla like?
My week at Benalla was fantastic. It allowed me to open up so much more in terms of pharmacy as a whole. I got to experience some things that a lot of places don't really have access to in bigger areas, so it was really great to have access to a lot of the smaller community health things that we see in the rural areas. So the high-risk foot clinic, I got to sit in on a few theatre cases, seeing the local aged care facility, and just so much more. It was really good to branch out into all of those areas.
And so what was it about North East Health that made you think, I'll apply in the first round to that hospital?
So North East Health has 2 locally funded positions, which makes it a really appealing choice for anyone who's interstate, because it allows you to be selected for first round potentially, and not a lot of places in Victoria do have that option, so it's really good for anyone who's based outside of Victoria to try and apply and get down to this lovely country.
Hi, I'm Jackie. I'm one of the pharmacists at North East Health Wangaratta.
And what brought you to this part of the world?
So I'm originally from down in Gippsland, which is, I guess, a more regional or rural area of Victoria as it is. And I've always been really drawn to, I guess, healthcare in that kind of area. I know that Metro Melbourne has so many services to offer, but growing up, we kind of had our local hospital, which was a lot smaller. And I always liked the idea of, I guess, giving back to the community, and especially smaller communities. So I was really excited about the opportunity to move somewhere I guess it might have a little bit more limited service compared to Metro Melbourne, but I guess giving back to the smaller communities and learning in that kind of environment where I guess you get to know patients a little bit more one-on-one and have those ongoing relationships.
So what was it about Wangaratta that attracted you to come and work here?
Yeah, so I had a look at all the different hospitals when it came to applying for internships, and something that really drew me to North East Health Wangaratta was their care and kindness value, treating patients with respect and making sure that they had that really big value on kind and compassionate care, which for me is a huge part of providing care to patients. So I wanted to make sure that wherever I went, those values were incorporated. In addition to the rural site, I was always really drawn to the pharmacy department. The calls that I had with the director and the deputy director, they were always really kind and welcoming and supportive, and that hasn't changed since I've been here for almost 18 months now. The door's always open to chat about anything that I'm concerned about or that's on my mind, or even just a friendly catch up, which I think is great to keeping the positive environment of the pharmacy department.